Welcome back to Atlanta News First Plus as we talk about all things health. And did you know that about 230 million people who use AI ask health related questions out of softwares like ChatGPT nearly every week? A lot of people turning to artificial intelligence here in the digital age as they work out their symptoms, when they should see a doctor, and get answers to questions about their health. And we want to break down exactly how you should and shouldn't use AI and what it means for doctors nowadays with patients trying to navigate their own symptoms using tools like these. To help me, I want to bring in Wellstar Health System's urgent care physician, Dr. Andrew Thornton. Dr. Thornton, thank you so much for being here. We had you on here the last time, but very important conversation. And I'm curious if you have had patients who have started their conversations with you saying something like, I talked to ChatGPT and they said.
Absolutely. We do hear that in the urgent care setting, and I'm sure that doctors in all settings are hearing that. Chat GPT use and use of other AI tools like that has exploded in the last couple of years. And as you mentioned, health questions are one of the predominant questions asked by people. And I think it's very important for us to keep that in mind, that even if patients are not telling us that they're asking Chat GPT questions, we know that many of them are. We do have patients that will come out and tell us that at the beginning of the visit. Sometimes it won't come out until later, after we've already discussed their symptoms and possible diagnoses, possible treatment plans. Then they may tell us at that point that they have looked up things on ChatGPT. So they often do reveal it at some point. I think it's becoming much more accepted by both patients and physicians that this is a common source of information. And I think it can be a good thing, and I try to approach it that way as a physician. It can be a good thing on both sides to acknowledge their concerns and the reality of the information they're receiving, and also just what they're worried about. So I prefer to know if they are looking up those things, and sometimes I will ask them specifically. But absolutely, any visit that we see patients on, we can assume that they have often resorted to AI for information.
Yeah, certainly. And there's a lot of benefits and dangers that I want to get into. Just to highlight some of the things that are asked of AI in the health related topics is learning about conditions, is figuring out what specifically symptoms mean, but also understanding medical terminology. I mean, going to the doctor can be a daunting thing where you step into the office, you say, I think I have this going on, and then you try to keep up with a very well informed physician who breaks down and explains what might be going on with you. I know a lot of people find it intimidating to advocate for themselves in the health space like this. So when you hear about AI kind of being used as a tool for this, what goes through your mind?
The first thing that goes through my mind is I want to normalize it because it's such a common thing. It's not going anywhere, and we know patients are using it, so we might as well meet them there and discuss it in a realistic way, in a practical way, so that we can help them. So my first thought is I want to make them feel comfortable that they did that and that it's okay. I don't want them to feel guilty. I think some patients worry that if they tell us they've looked up something on AI or even just Google, that we will judge them and think that that means that they don't trust us. And I don't think it means that at all. Patients are just looking for quick sources of information. Patients are not medical experts, and they want to have some information sometimes to know if they need to come to the doctor. And if they do need to come to the doctor, they want to try to be well informed. So I think that's a good thing. Sometimes they can become overly anxious because of AI or because of Google based on their symptoms. And sometimes the opposite. Sometimes they can be not concerned enough about their symptoms. What I prefer is that they come in and tell me what their true concerns are, and that I address them, and that I give them an unbiased approach as a physician, that I can tell them and steer them in the direction that I think it needs to go based on the symptoms they're telling me.
Yeah, are there conversations amongst yourselves and your colleagues within the health space about utilizing AI in diagnosing or how best to work with patients collaboratively using AI?
Absolutely. It is a common discussion these days amongst healthcare providers because there are tools that we can use as healthcare providers just like patients use them. So it's really used on both sides. I think that's important for us to all acknowledge. One thing that comes up in the healthcare world is potential liability if we are using AI tools to help us make diagnostic decisions or treatment decisions. Where does our liability start and finish? Does it put us at risk for, getting inaccurate information? So we have to be careful as healthcare providers which tools we're using, and that we're using it as an adjunct to enhance our decision and give us more information to help us put the whole picture together. But we need to be very clear when we're diagnosing and treating patients that it is our clinical decision, it's our clinical judgment that is driving our decisions. AI can be used as an adjunct, but it should certainly not replace our own clinical judgment.
And when we talk about the AI space, a lot of people also lean on this tool because going to the doctor can be expensive, and it is sometimes requires multiple visits and almost like an exploration that leads to more money being spent. Some folks are not all that able to communicate in a healthcare space in a doctor's office, maybe due to language barriers or lack of understanding surrounding their specific health concerns. So I'm curious, your recommendations on the green lights on how to use AI in this context and the absolute no-goes on where you shouldn't be taking AI in your medical concerns.
I view it the same way I view it from a healthcare provider standpoint. It should not replace um, the normal avenue that we recommend, which is seeing or consulting with a healthcare provider. It should be an adjunct. It should be an additional source of information. It should not be used to solely diagnose you with a certain condition. It should not be used to solely guide your treatment decisions on your own. I would view it the same way as consulting a person who is not necessarily licensed to give medical advice, who may not be a healthcare professional, but may be a very smart person that can give good advice about many topics and may have some healthcare knowledge. That person should not be used as a replacement for a healthcare professional. They can be used to just give some general advice, give some additional information that can help you be encouraged to reach out to your healthcare provider. So I view AI as the same way. I think it's very important for patients to realize that, even the policies in AI tools, for example, ChatGPT just in October changed their policies to make it clear that they are not able to diagnose and treat conditions for specific symptoms. And I think it's important for patients to know that. And I hope that they're working on ways to make that very clear when patients do look up medical questions, that they're making it very clear that you should reach out to a healthcare professional, that it's just used as educational content. I think it's very important for patients to understand that AI tools like ChatGPT will often hallucinate, which means that if it doesn't know something, it won't necessarily tell you it doesn't know. It will sometimes fill in the gaps with inaccurate information. And also, it's important to keep in mind that an AI tool is not looking at you as the patient. They're not examining you. They're not taking your physical appearance, your demeanor, your tone, into context with the symptoms that you're providing. So it cannot give a comprehensive diagnosis or plan like a medical professional can.
Yeah, well said. And, we talk about using AI to possibly get clearance on medical terminology to maybe ask those initial questions before seeing the doctor. But what about a second opinion? Going to AI after you've seen your doctor, after you've had that conversation, and maybe you're still not sure that you were accurately assessed. Can AI help with this?
I think that, like you mentioned, you can get additional information, I would say, about specific diagnoses. So you could use it as sort of a follow-up tool to a visit that you have had with a healthcare provider. For example, can I get more information about this condition? Can I get more information about this medication? Are there questions that I should ask my doctor because I'm not understanding this part of my visit? And before a visit, you can use it as sort of a pre-visit planner, telling ChatGPT or whatever AI tool you're using what your symptoms are and what your concerns are, and asking what questions could I ask my doctor to help answer my concerns. So I think those are safe territory. I think if it ever steers you in a different direction than the doctor did or the healthcare provider did when you saw them, you should then follow up with that healthcare provider and be honest with that provider and tell them that, you receive some additional information, ask them what he or she thinks about it, and not just leave it at that as a sort of second medical professional, which the AI tool is not.
It certainly is not. We talk about this AI, the digital age, and using these tools to aid you in advocating for yourself in the health space. Let's say that someone doesn't want to use AI. They say, I just want to have a face-to-face conversation with a licensed medical professional and my particular doctor. How should they go about advocating for themselves? Are there any tools or knowledge that can help them in independently coming into their doctor's office and walking away with confidence?
Well, I would say anytime you want to just use the internet and not use AI specifically, you would want to stick with trusted medical sources. For example, websites that end in .org, .gov, .edu. Those are going to be non-biased sources of medical information. For example, the Cleveland Clinic, the Mayo Clinic, others like that. Those are fine to also obtain information before seeing a doctor. And I think writing down your questions is helpful so that you can remember them when you see the doctor. And I think just having good communication tools with your doctor, a lot of healthcare organizations utilize these sort of chat apps, access that you can have with your doctor to ask a question before your visit or after your visit. And I think that's how those tools are best used. It's an adjunct, it's a way to follow up with something that you might not have understood or you might not have thought to ask about while you were at the visit. So we have lots of ways of doing that. And it's unfortunate that a lot of doctors are limited in their access in terms of availability. Often there's long wait times to get in with your doctor, and I think that opens the door for these other tools. And so that's why we have to understand that patients are going to utilize them. If we can't get them in a timely way, they are going to go to these other sources. So I think opening up as many communication avenues as possible is extremely helpful for the patients.
And Dr. Thornton, you work in the urgent care space. You regularly deal with patients that come in, and there is a sense of urgency with trying to figure out what's wrong with them, with trying to get those answers. And in moments of urgency like that, we can sometimes panic and kind of reach for the fastest solution that we see. So is AI helpful in a more immediate space where health information and diagnoses are needed much faster?
Well, from a physician standpoint, we can certainly use AI tools to help us make decisions. We need to be careful that we're using ones that are either FDA cleared or that they are providing links to sources of where the information is coming from, for example, scientific studies. And there are many AI tools that have gotten very good and very helpful for providers that we do have access to. I think it's important for us to document that we are not solely relying on AI to make these decisions, and we can certainly source where the information is coming from if we're using it to make decisions. So I think it can be helpful for getting us expedited information. That's the positive of AI, is it brings information to you. It keeps you from having to sift through many websites or back in the old days, books to find information. We can actually have it brought to us by simply asking a question. So it can be incredibly helpful. The same is true for patients. They can obtain this information very quickly. They just have to understand that it is not diagnosing them. It is giving them additional information that they can then use to enhance their visit with their provider.
Yeah, well said. Dr. Thornton with Wellstar Health System. Anything that I didn't ask? I know this AI topic is something that a lot of people have clearly gravitated towards, with health questions being one of the top things that folks use AI for. But anything that I didn't ask, I know you see a lot of patients, and this comes up time and time again.
Well, one thing you may hear about, just in January, ChatGPT is in the process of rolling out something called ChatGPT Health. There's a wait list for it. It's a bit controversial right now because there are some concerns about privacy, but the way that is supposed to work is patients can actually upload their medical information into ChatGPT, into a protected, secure environment that is separate from the normal ChatGPT. This is a brand new concept, and the idea is that so many people are asking medical questions of ChatGPT that they decided to create its own space specifically for health information. Even that is not going to replace physicians or providers, but it'll be really interesting to see where that goes because of privacy laws and HIPAA concerns. And I think that brings up the general question of what is the regulation of AI tools. I think this is a huge, huge issue right now with how this has exploded and how people are using it. There definitely needs to be a lot of safeguards being put in place very quickly that is keeping up with the expansion and growth of these tools, because there's a lot at stake when you're talking about healthcare and sensitive issues like that.
Would you say you're cautiously optimistic?
I am. I think that the oversight is what I'm hoping to see expanded. I think there needs to be a lot of collaboration with the healthcare world, as well as with the government, about laws that are put in place to protect people and keep them safe so that they are not led astray, as we have seen happen a few times. So I really, really hope that that collaboration is going to take place and that it will put these appropriate safeguards in place.
Dr. Andrew Thornton, thank you so much talking with us for our weekly Ask a Doctor segment. If you have a topic you want to discuss or a question for doctors like Dr. Thornton, who is an urgent care physician with Wellstar, make sure that you tag us and send us your questions. We'll make sure to ask them right here on ANF Plus. In the meantime, we're going to post this full interview for you on AtlantaNewsFirst.com, as well as links to Wellstar if you'd like to connect. Make it a great day.